Welcome to Rebecca Sounds Reveille. I am enthused today to talk about something that many people don't want to talk about, but the guest that we have is just, oh my goodness, so phenomenal in the background that he has, the work that he has done. He's ran as a Democratic candidate for the delegate in the 2014 election cycle. He has served as president in a citizens association, which he'll tell you about himself. He is host of a podcast, and he'll tell you more about that as well as we talk about his background. And he is president of Revealing Our Humanity Communications. This is so important. And there's a lot that he has done. He's an accomplished person in many, many ways. And he's going to talk to us today about something that a lot of people don't talk about, and it's required healthcare and the things that you need to know about that. And why do we need to know about that? Because there's laws in place, and we need to know all of the little details, and then some of the good things about it that's going to really make a difference for us. And I'd like to welcome to the show Jordan Cooper. Welcome.
Thank you. It's a pleasure to be here.
I am super excited. You've got a background that is absolutely unbelievable. I want to talk for a minute about your presidency of Revealing Our Humanity in Communications. Can you share with us a little bit about that?
Sure, yeah. Well, Revealing Our Humanity Communications is a small PR firm that works on political consulting and public relations work for various clients. It's an outgrowth of a public interest podcast, of which I'm the host, which is a daily podcast, which I release based on a weekly theme where I interview politicians, activists, advocates, and others who seek to improve the state of the world.
I love it. I love it. And there's a lot involved in that. And you know your stuff, don't you?
Yes, there's a lot of work involved, to be sure.
I'm super excited. You also have a master's degree from Johns Hopkins in health policy, correct?
Right, yes. I have a master's of science in public health from the Johns Hopkins Bloomberg School of Public Health and Health Policy. Would you care for me to elaborate on how I ended up choosing that route?
Oh, most definitely.
So I've been involved in public service for about 15 years or so, volunteering almost every month of my life since 99. And I ended up getting involved in Maryland politics, worked as a page in high school, and then after college, I worked as a legislative aide in the Maryland House of Delegates and sat on a number of boards. I continue to sit on a number of boards. What happened is while I was serving as a staffer in the Maryland General Assembly, my boss was the vice chair of the subcommittee on health and human resources for the Appropriations Committee. And while that was happening, President Barack Obama had just been elected in the winter of 2009 and was one of his top legislative objectives was to pass some version of healthcare reform. And so they began a year-long process of trying to pass what would eventually become the Patient Protection and Affordable Care Act. Okay. And so while I was working on the state level with implementation of healthcare reform, which has been going back in various iterations for decades, I was watching the legislative process in the federal level on Capitol Hill, and that's what led to me to decide to pursue a career in health policy.
Well, this is pretty amazing. And so we're going to talk today about, required health care and how that works. And, with the changes that are coming with our new president in place, I think that there's some things that the audience really they really need to know. And I think you are the man to share all about that. So can you tell us about required health care as it stands right now?
So required healthcare. So, well, I guess we can talk about what's referred to as Obamacare. The current president ran in opposition to that, and the U.S. House of Representatives passed a version of what might be eventually called Trump Care, which is the current administration's attempt to repeal and replace Obamacare. Of course, the United States Senate, as of this taping, has yet to take action on that piece of legislation. So it remains to be seen what will happen there. But in order to talk about the repeal of Obamacare, I think we ought to first begin with what is Obamacare. Sounds fair?
Excellent. Excellent.
So Obamacare is basically two things. It's Medicaid expansion at the discretion of the states, and I'll explain what that is in a minute. And then it's a bundle of pilot projects, a lot of experiments that have worked in different parts of the country, which will be able to be rolled out at this, through the private sector and discretion of states again. So before we even go into what that is, let's define what Medicaid and Medicare are. So President Lyndon Baines Johnson in 1965 passed the Social Security Act of 1965. And the Social Security Act established Medicare and Medicaid as well as Social Security. Social Security being the checks you receive in retirement, and Medicare being federal health insurance for those who are age 65 or older, and also for others in special cases with disabilities under the age of 65. Medicaid is for the poor. So Medicare is for elderly, Medicaid is for the poor. Poor is being defined as some portion of the federal poverty line. So the federal poverty line is defined by the federal government, and then different states have opportunities to determine Medicaid eligibility for citizens of their own state based upon their income eligibility. So for instance, you may have a state in a Republican part of the country that would like a smaller size government, and they may have a threshold, a maximum Medicaid eligibility threshold of say 45% of the federal poverty line. You may get another state like Maryland, which is a more progressive Democratic state, and before Obamacare passed, you're going to already have something like 135% of the federal poverty line. So if the federal poverty line is $20,000 a year for a family of four, then you're eligible to be on Medicaid. I'm making these numbers up. Let's say if you earn up to $25,000 in Maryland, but that same family of four, if you move down to Alabama, would not be eligible for Medicaid. The maximum, let's say down there, would be $7,000 a year. Making up numbers, but just to demonstrate how there's huge variance in Medicaid eligibility by state. So a big part of what the Patient Protection and Affordable Care Act, which is also known as Obamacare, or the ACA for Affordable Care Act, which was passed in March of 2010. Basically, a large part of that is Medicaid expansion at discretion of states. So before the Affordable Care Act, when you have a poor state, let's say, I just said Alabama, and again, I got to make up the numbers so I don't know the specifics for each state. But in a poorer state, you might have the federal government providing an 85% match to 15% state dollars. So if you wanted to have a multi-billion-dollar Medicaid program, 85% of the funds would come from the U.S. Congress and 15% from the state legislature in Little Rock. Okay. Now, in a more wealthy state such as Maryland, you might have a lower threshold for the federal match grant. So you might have a few $billion-dollar Medicaid program. In Maryland, we have about $12 billion, I think, is the largest proportion of the DHMH, Department of Health and Mental Hygiene budget is about $12 billion, and the largest proportion of that budget is taken up by Medicaid. And basically, there you would have a federal match of, let's say, 70 or 75% of federal dollars with 25% of state funds. So more state funds required. Now, what the Affordable Care Act did is said, well, we're going to ask you, let's say Alabama, to bump it from whatever your threshold is now, let's say 35%. And we're going to ask you to bump it up to 135%. And then, Maryland had actually already done that in 2006. So in this part, Maryland wasn't too greatly affected by the Affordable Care Act. I speak about Maryland because that's where I'm from. That's where I run for office. If people are interested in learning more about my campaign, they can go to cooperformaryland.com.
Yes,
but basically,
talk about that as well.
So we'll get there, but just to run through the things here. So with the poorer states, because the Supreme Court made a certain decision, the Supreme Court of the United States made a decision on the Affordable Care Act, which was challenged as unconstitutional by various attorneys general from Republican states. The Supreme Court basically said everything is constitutional except you can't require all states to expand Medicaid. So it was Medicaid expansion at the discretion of states, governors, and legislatures. And so a lot of states have ended up adopting Medicaid expansion. They don't have to. And if they chose to adopt Medicaid expansion from the Affordable Care Act, that would be a 100% federal match. So whereas if they don't accept the Affordable Care Act expansion of Medicaid, they might still have a 75% match of federal dollars to 25% local. Now, if you do accept it, it'll go up to 135% of the federal poverty line, up from, say, 35%. So more people will be covered, and that entire cost will be borne by the federal government. So there's really not very much risk to state governments. Of course, Republican governments say, well, first of all, we don't feel comfortable. Those federal dollars are still our tax dollars. We pay federal taxes, so we don't want our money spent there. Republicans may also say, you know what? We understand that right now is a 100% federal match, but we think that 10 years down the road, Congress will change their minds and they'll reduce it and it'll have a greater impact on the state budget. So that's the argument against it. That's Medicaid expansion. So on that particular point, if President Trump were to be successful in repealing and replacing Obamacare, first of all, the specifics aren't too clear. It is clear that the Congressional Budget Office, which is a nonpartisan organization, has scored, which means reviewed the president's budget, and has determined that about 23 or 24 million Americans would lose their health insurance if it were to be passed. And part of that would be because you would have states who had 100% federal match up to, let's say, the 135% federal poverty line. Well, they would lose that, and it would go from 100% down to, let's say, the 75% federal match. And if the states didn't come up with that 25% state match, then those people who were receiving Medicaid eligibility through the Affordable Care Act would lose their coverage. So that's one part. And then another part, a big part about the Affordable Care Act are health benefits exchanges, health information exchanges, incentivizing electronic health records. That's what I've worked on, quality measurement enterprise, a lot of good stuff.
What I'm wondering, though, is if there's a change, is that with the Trump care that would come, is there still going to be a requirement then that Americans have health insurance?
Okay, so I think what you're referring to now is something referred to as the individual mandate.
Okay.
So the individual mandate is something that originally came out of the Heritage Foundation in the early 1990s during the presidency of H.W. Bush and especially Bill Clinton. Bill Clinton having one of his top legislative priorities being to pass healthcare reform. He ultimately was successful to some extent in the second term with the passage of CHIP, which is the Children's Health Insurance Plan, which was an expansion of Medicaid for children. He was not successful in his broader initiative to get universal health insurance coverage. But the idea came out of the conservative Republican think tank that you have an individual mandate, meaning every person has to buy insurance. And I'll explain the rationale for that in a minute. The Obamacare, the Affordable Care Act, that actually included an individual mandate. So basically, if you don't buy health insurance, then the IRS would, in theory, fine you for not getting health insurance. Now, it's not clear exactly what Trump would like to do, but it seems like he doesn't like many aspects of Obamacare, and if that is a big part of Obamacare. So I think he would want to eliminate the individual mandate. Again, there's a disconnect in the American public. According to polls, most Americans support most elements of the Affordable Care Act, but oppose the concept of Obamacare. There's a disconnect, and most Americans believe kids should stay on their parents' health insurance plans until the age of 26, but hate Obamacare, which is the same thing. Most Americans think that expanding Medicaid with federal tax dollars is a good idea, but again, hate Obamacare. So there's a disconnect there. And you asked,
go ahead.
So you asked about the individual mandate and why that would be important. So right now, there's a law that was passed in 1986 called EMTALA. That's an acronym, and it basically requires basically what it does is it creates a universal health insurance system through 911. It says you don't have to be an American citizen. You can be a tourist. You can be an undocumented immigrant. You can be a citizen, any type of person. You can be a citizen who's uninsured, any type of human being. All you have to do is call 911, and an ambulance has to come and get you. And furthermore, the ambulance has to bring you to a hospital. And then, even if you have no health insurance and no money, you can't pay for anything, the hospital must triage you and take care of you. Because, and this came about because there was a rash of deaths where people would go to the ER and the hospital would say, well, you don't have any money, so we're not going to treat you for free. They'd turn people away and the people would die. Right. So the U.S. Congress said that's a bad idea. We don't want people dying in the street. So regardless of your ability to pay, you have to be stabilized in an ER and brought there by an ambulance. The problem with that is that costs thousands of dollars. Right. It costs a lot of money. It costs $800. Prices are very variable, but it could cost $800 for an ambulance ride and $1,200 for an overnight stay or just to get in it. I mean, it's just a lot of money, whereas the same sort of thing, if you had a cough or a stubbed toe, could have been taken care of with a $100 office visit to a physician if you had insurance.
Right.
So right now, in a sense, Americans already do have universal health insurance coverage in the most inefficient and overly expensive way possible, such that the United States spends more than twice per capita on healthcare than any other country in the world. So if you're looking at the United States spending $8,000 per person on healthcare, the next most expensive country, which is Norway, will be spending something in the order of $3,500 per person. And yet, we're not getting the best healthcare quality. We have lower life expectancy, higher infant mortality, a higher burden of chronic disease, and are ranked around 37th in the world in terms of quality of care. So this individual mandate was saying, look, everybody already is paying for everybody else to get health insurance coverage. The question is how, we're just not doing it efficiently or well. So if you had a universal health insurance requirement, then everyone would be paying into the system. The idea being that everyone uses healthcare, everyone needs healthcare, you're just not sure the extent to which you'll need it or when. So with this individual mandate, what happens is you say, well, people, which are the bulk of people, are going to pay some money, and together it's going to be a lot of money, and most people are never going to use it for that year that they're paying the premiums. And then there's going to be a small amount of people, the people who get hit by a car, the people who get diagnosed with brain cancer, the people who have bad things happen to them, and they're going to cost tons of money, so much money that there's no way they could ever afford it individually, no matter how much they save. And everyone else in society is going to pay for their chemotherapy and whatever. And that's how health insurance risk pooling works. If Trump gets rid of this, it'll make healthcare costs balloon. Healthcare costs will accelerate, and it'll take an even greater proportion of the federal budget. Right now, Medicare and Medicaid combined account for the greatest proportion of the United States federal budget, even greater than defense. So removing this individual mandate and would increase that cost, except for this fact that they would be offsetting some of these increased costs by reducing the number of people who are covered with health insurance, which again are still covered through our 911. So it's very complicated.
Okay, well, and we really don't want people to utilize the 911 system to get healthcare. We want them to go and do preventive healthcare checks and so on and so forth. But what I'm wondering is that if you have a person who is limited on funds and we have a requirement that they have insurance, then so generally speaking, if they hit the poverty level, they can get Medicaid. But what if they're in the in-between situation where they can't, go to an insurance agency that's charging $400 a month for healthcare and they don't qualify for Medicaid? Where do those people fall in, and how does that work?
Sure. So under the current law of the land in May 2017, which is the Obamacare is still the law right now.
Mm-hmm.
Basically, up to 135% of the federal poverty line in states that accepted federal assistance for Medicaid expansion, it's basically free. You get free health insurance coverage. That's it. You're that poor, you get Medicaid, you're a beneficiary, you have access to everything, done. Okay, but the question is, when you're between the maximum threshold of eligibility for Medicaid and some higher area where you can afford to pay health insurance on your own. But there's a few things there. One, Obamacare set up something called health benefits exchanges. So first of all, you can get health insurance through your work, but if your work doesn't provide it, you go to the individual market in the health benefits exchange and you choose a platinum, gold, a silver, or a bronze plan. And these four metal plans, metals because platinum, gold, silver, and bronze are all metals, basically are, if you do a platinum, you're going to pay a higher premium, which means monthly fee. And then when you see a doctor, your copay and your deductible will be lower.
Right.
And then a bronze would be, I pay lower every month, but if I ever do need care, I pay more money at the point of care.
Okay.
So what I'd do is I'd select my plan and through a private health insurance company in the market, and I choose platinum, gold, silver, or bronze. And then I'm eligible for federal subsidies up to, if I have a family of four, if I make under $84,000 a year, then I'm eligible for various levels of federal subsidies to help purchase this insurance on the health benefits exchange.
Okay, I understand now. So that's very, very interesting. And because I know a lot of individuals who are concerned about that. What do I do? And I've got, when I go to do my taxes at the end of the year, I've got to provide proof of insurance, and I'm kind of stuck. So I think that is something that is very educational to our viewers, because there's many Americans out there that they just are in a position where they thought, well, I don't qualify for this, or the cost of some of these larger healthcare providers, insurance providers, is astronomical in comparison to what they can afford. So I think that is a really good point, and they can look into that. I had no idea that was even available. One of the questions, though, I have for you is, my understanding is that if someone uses like Medicaid and they are going to the hospital, then if they pass on later in life, then the government can come after part of the estate to cover and recoup the costs of what they had utilized under the Medicare or Medicaid plan.
Well, before we go into that, I just wanted to touch on the previous point, which is health insurance is not unattainable for anyone, should not be unattainable for anyone because of cost. Basically, if you have under the threshold, you get Medicaid, zero cost, and then up to, and then basically the federal government determined that you should not spend more than X percentage of your household income on health insurance. I forget what that percentage is. It may be something between 9% and 15%, but basically the federal government said you'll never have to pay more than that amount of money for health insurance coverage. And so if you do make, let's say, something like $50,000 a year, then they would give you enough subsidy so that the amount of money you would spend on health insurance through the exchange every year would be equivalent to that 15% of your annual income that they determined, or 9% of the income that they determined is appropriate for health insurance coverage. I think it's in the single digits, but I'm not entirely sure. The point is that health insurance coverage should not be unaffordable for anyone. On your second question about what happens if you're a Medicaid beneficiary and you pass away, and you're talking about recouping costs, could you elaborate on that question?
So my understanding is that, let's say someone has some kind of condition and they end up going in the hospital, and Medicare or Medicaid pays for that. And so because they were eligible to receive that benefit, but later in life, they pass away, and then the government wants to recoup the money that was paid out while, say, they were in the hospital.
I've never heard of that happening. So basically, there's Medicare and there's Medicaid. And Medicare has many Medicare beneficiaries will know that there's such a thing as Medicare Part A, B, C, and D.
Okay.
Medicare Part A takes care of hospital coverage. Medicare Part B, and Medicare Part A is given to every American at the age of 65 or over, and that's taken care of. That was a payroll deductible funded mandatory spend by Congress, and so that's called an entitlement spend.
Okay.
You may hear Congress talk about entitlement spending. So that's Medicare Part A. Medicare Part B is seeing your doctor, basically outpatient care. Medicare Part C is I want a private managed care organization to provide my Medicare services, and that's what that is. It's HMOs, health maintenance organizations. It's private companies that administer federal public health insurance. Medicare Part D, which was passed under President George W. Bush, is prescription drug coverage for Medicare beneficiaries. And so Medicaid, again, is for the poor. Medicare being for the elderly. So if I'm a Medicare beneficiary, I have Medicare Part A, I go to the hospital, Medicare pays for that hospital coverage, I leave the hospital, I forget about it, that's in my past. Medicaid coverage is, I've already spent down, and a lot of Americans use Medicaid to pay for long-term care and nursing home care. And the way you do it, you spend down your assets. So you need to have a certain level of assets that you are beneath. So a lot of people spend down their life savings on long-term care and nursing care, and once they become so poor because of their healthcare expenditures, they spend themselves into bankruptcy. In fact, 40% of all personal bankruptcies in the United States are related to healthcare costs. So when they spend themselves, right, which could be perceived as a disgrace, or could be perceived in some other fashion. I'm trying not to be partisan tonight.
Sure.
So could be perceived, I guess, a more conservative viewpoint would be perceived as a lack of financial responsibility and dealing with not having insured yourself adequately. I think that might be a conservative approach. So with Medicaid, you spend yourself into poverty, and when you reach poverty, then you go to the hospital, you get the care that you need, or you go to the long-term care facility, skilled nursing facility, they pay for it, and you're done. In no case should a Medicare or Medicaid beneficiary have well, first of all, a Medicaid beneficiary won't have very many assets, period, after they die to be seized because they're poor. But neither a Medicare nor Medicaid beneficiary should have their personal assets seized years after service was delivered, not through public plans. That may happen with private health insurance companies. If you are uninsured and you go to a hospital and you're not insured by Medicaid or Medicare, you're just an uninsured individual, that care will be covered in a few ways. All hospitals, most hospitals and most health insurance companies in the United States are not-for-profit organizations, which means that if you take a large corporation like Coca-Cola, they pay something called a corporate income tax to the IRS. If you take a large health insurance organization like Blue Cross Blue Shield, they pay 0% corporate income tax. And when you take most hospitals, they also pay 0% corporate income tax, even though they're making billions of dollars a year. So what they do, the IRS says you can be nonprofit. What you have to do, excuse me, is you have to spend equivalent of up to 5% of your annual revenues on providing community benefits, the majority of these being uncompensated care. So they write this off, say it's a benefit, I don't have to pay taxes, and then they could send a collection agency out to you. And that a collection agency could come after you for years trying to collect the money that they already wrote off as compensated care that they attribute to the care they provided to you years before. And that Democrats would say that is a crime and a shame.
Very, very interesting. And speaking of that, let's talk about for a minute your candidacy in the Democratic arena.
Sure. So In 2013, actually, I decided to run for the Maryland House of Delegates to represent the most well-educated area and one of the most wealthy areas of the United States, which is Bethesda and Potomac, Maryland, in the DC suburbs. I ran an 18-month campaign. I personally knocked on 12,000 doors. I had a team of 80 people volunteering and joining me. I sent out 140,000 pieces of literature. I met 40,000 people personally. I earned 50 pieces of earned media. I raised $60,000 and came in 5th place in a race where the top 3 win, getting 2,900 votes on June 24th, 2014.
This is incredible. And I know that running for an office is very, very difficult. There's a lot of time that you have to invest in doing that. And there's a lot of funds that you have to raise to be able to do that. How did you go about obtaining those things?
Well, I had been involved in Maryland politics since 2003 when I first worked for the House of Delegates. I had been around politicians for much of my life. I mentioned the decision that I made to go into health policy in particular while I was working for the Vice Chair of Health and Human Resources. At the time, I had an interest in international affairs. So I'd lived abroad in Spain and Turkey and South Africa and Senegal. But I knew I wanted to run for office, and you don't deal with foreign affairs unless you're running for Congress. And
Right.
I knew that in my area, you don't run for Congress until you're well into middle age and have some wealth and are more established in life. Rural areas of the country may be less competitive, but in my area, we just had the most expensive congressional race in American history, coming in at $22 million for one congressional seat.
Oh, I didn't realize that. Okay.
So for where I live, it's very expensive to run for Congress. So I said, look, I'm going to run for the Maryland House of Delegates. And to do that, I need to run on a domestic issue. Healthcare is 1/6 of the national economy. There's healthcare reform in the air. Maryland made some big mistakes that actually potentially contributed to the loss of Anthony Brown's gubernatorial bid, who was a Democratic nominee and the former lieutenant governor in 2014. So I said, let me go into health policy. I can appeal to voters on this. And that's a lot of what I ran my platform on. I've been involved in 20 campaigns as a volunteer throughout my life. And so I was ready to run, and I learned a whole lot while I was doing it. There's nothing that can prepare you adequately for actually being the candidate. No matter how many campaigns you're on, unless you're the candidate, you really don't understand exactly what it's like to be the candidate.
Right.
So I worked 120 hours a week for nearly an 18-month campaign.
That is absolutely amazing. That is a lot of work and a lot of energy to be able to do that. How are you able to raise your funds? I mean, the campaign contributions can be very challenging, but if you're in the most expensive area, you really needed a lot of funds to ensure that your message was getting out there and your platform was being heard.
Right. And again, I want to distinguish between my personal funds and my campaign funds. So I left my job so that I could work full-time on the campaign.
Oh my goodness. Okay.
So, right, because you can't knock doors 8 hours a day when you're working 8 hours a day. And so where's the money that you use to pay for rent? And where's the money that you use to pay for breakfast, lunch, and dinner? Where's the money that you use to pay for gas? I'll tell you what, it's not campaign funds, those are personal funds.
Right.
Okay, so the campaign funds can only be used for campaign-related activities. So most of my campaign funds, I'd say 90% went to United States postage stamps.
Okay, a lot of mass mailing there then.
Right, direct mail is the most effective. That and printing costs were the majority of my costs. I'd say 95% of the costs of my campaign were either printing pieces of literature, pieces of mail, yard signs, bumper stickers, or mailing them. And mail is the most expensive component of that. Mm-hmm. You could also pay staff and pay office rent for a campaign headquarters, but that's usually for a larger campaign.
Right.
So it's important to know that I made no money. I worked for free on this campaign. I made absolutely no money on my campaign. I raised a lot of money, but I spent it all on the campaign and was not allowed to go out and buy a T-shirt or go on a vacation or use any of that money for personal benefit. That's incredibly important because if I were to cross that line, that would be a criminal activity, and that's the definition of corruption.
Yeah.
So You can actually find all of my political expenditures and the name of every single person who contributed anything to my campaign at the Maryland State Board of Elections website. And you can learn about all my campaign activities and videos at cooperformaryland.com. And that led to me actually starting my podcast as a means of getting out increased voter turnout, which is available at publicinterestpodcast.com or on iTunes or any other podcast platform. And that was designed to say, look, these candidates spend so much time getting out there, and yet, only 1 in 6 registered Democrats voted, and only 1 in 10 adult voters actually showed up and voted in that off-year gubernatorial primary. So what I said is, well, if nobody's voting, even in the most well-educated and wealthy area, which is traditionally correlated with voting, and the candidates are working as hard as I worked, I knocked on every Democrat's door who had voted in previous primaries. I said, we have to use technology to get the name out about these different politicians. And especially with our local newspapers shutting down because of news on the internet, I said, let me begin interviewing all these local politicians and providing the electorate an opportunity to get to know them, even when that person isn't coming to their door. And I thought by doing that, we're giving them a better opportunity to meet the candidates. I think they'll be more invested in actually turning out and voting. And then maybe we'll get some healthcare reform that actually makes sense for the common man.
Very, very impressive, the background that you have, the knowledge you have. It's absolutely unbelievable. I can't even begin to imagine how you have been able to accomplish so many things in just the hours alone that we have in one day. And 120 hours a week is a lot, especially when you're really focused on that and you're having to not only worry about campaign funds, but personal funds and being able to achieve all that. I am impressed with your dedication and your knowledge so much. I think that what you have to share is very, very informative for everyone, regardless of whether they're Democrat or Republican or independent, any type of party. I just think that the education alone really can help people make informed choices in what they're doing. I'm wondering though, Jordan, are you planning to run for an office again?
100%. Right now, there's a political merry-go-round, musical chairs, I like to call it, where there's a vacancy at the top and it ends up creating dozens of vacancies at the bottom.
Right.
So, as you may or may not know, Maryland currently has a Republican governor. Though I'm nonpartisan on my podcast, I am a Democrat when I am wearing my political hat. And so the Democrats are seeking to take back the governor's office. So there's a number of Democrats who are considering running for governor. And so one man in particular may or may not run for the Democratic nomination. His name is Congressman John Delaney. And if he vacates his seat, then a current delegate in my district, Delegate Bill Frick, has already filed with the Federal Election Commission to run for that congressional seat, therefore creating a vacancy for me to fill in a campaign next year for the Maryland House of Delegates because he'll be vacating to run for Congress. So when one vacancy happens at the top and all these different people run to fill that vacancy, then they vacate their elected offices and create opportunities down the food chain for lower level elected officials such as I might be if I were to win.
Right.
So yes, I've had fundraisers and I'm running for a vacant seat in District 16 for the Maryland House of Delegates, and the website is cooperformaryland.com, and you can see me on YouTube as well. I did media stunts and we were able to get some pretty good radio and TV when I did a great race to beat traffic. I wore a black suit on a sunny day, rode a Capital bike share bike down a 5-mile-long dirt path between Bethesda and Silver Spring, and I raced against a friend of mine on Metro and a friend of mine in a car in the third worst traffic in the United States, and I actually raced down, and so that was that, and we all got there, and that was a fun race to demonstrate the need for mass transit with a purple line, which would be an extension of Metro, in conjunction with the Capitol Crescent Trail needing some bicycling lanes. So. It gets creative and fun and it's invigorating,
Uh-huh.
It's just a whirlwind of an experience, and I'm in it for the long haul. I think the whole war is your lifetime, and then each individual election is actually is an individual battle. So for me, the campaign is one that began in childhood and will end in old age, and each individual election is merely one portion of that campaign, and you can't let yourself get discouraged. And that's why I'm working on Public Interest Podcast. It's an extension of the campaign. It's my idea of this is how we're improving the world. This is how we're advancing public interest. And even though I'm not in elected office, I'm still able to make a change to help make our world better, as you are with your Rebecca Sounds Reveille. And I'm hoping to inspire all of your listeners to also advance the public interest and do public service, regardless of whether they ever see themselves as being involved in politics or not.
You have just said something so impactful, and I absolutely love it. Jordan, I am super impressed with everything that you're doing. I wish you much success, and if there's anything that I can do, to, again, educate people and help them like you to make the world a different place, a much better place, and where we can make changes, I'm all for it. And I want to thank you so much for sharing your knowledge today with our viewers. I am just delighted to have an opportunity to expand my knowledge on this particular topic, and even more so in the conversation that we've had. Thank you so much.
You're welcome. Thank you for having me on your show.
And I want to thank all of you for watching today. I hope that you've been able to find some very important information that you need to know. If you didn't have insurance and you're falling in between the cracks, there is something there for you. And I think that we need to take an opportunity to expand our mind in understanding all of the different things that are going on, because they do affect us, and you can make a change as well. Just like Jordan said, I am super excited about this. I hope you share the show with your friends, your family, coworkers, and all over social media. Thank you so much for watching. This is Rebecca Sounds Reveille.